You're very welcome to this talk. It's Monday the 17th of May and it's evening time. We're running a bit late today. Now, it's reopening day today in the UK. Lots of things have reopened and this is going to result in more cases. But the experience I've got from people I've talked to in a couple of parts of the country is that people aren't going mad. So town centres haven't been absolutely packed. People do seem, on the whole, to be behaving responsibly, which of course is remarkably good news. So, quick bit of information from the UK. People testing positive. So that was the Sunday number. That was the Saturday number. So, still quite a few people testing positive. And overall, last 7 days, there was another 15,540 people testing positive over the 7-day period. And that, I'm afraid, was up 1.1%. Deaths, thankfully, at a low level, although these are still 4 and 5 people that have died, but much lower than they have been, of course. So deaths up to 127,684. Last 7 days, 75 people have died. But again, the death rate's up slightly on the previous 7 days. Now, because the number of deaths are relatively small, we can't draw too much inference from these percentages. But the case numbers will start going up now because of the opening up and the India variant. Deaths over the last 7 days, 332 if you accept deaths on death certificates, which is probably the more accurate modality of measurement. Patients admitted to hospital, 103 over the last 24 hours, 751 over the past 7 days, just under 1,991 currently in hospital as we speak today on Monday. Weekly admissions down 1.2%. Ventilated patients 129. So we can see that things have improved a lot, of course, from the peaks, but this slightly worrying increase in cases, positively diagnosed cases. Vaccinations, now pretty good. So that's 131,000 on Sunday had the first dose. That was the Saturday figure, 237,000. So this is going well. This is now 69.7%, let's call it 70% by now, shall we, of the population over the age of 18 had the first dose, the primer dose. The booster dose, the second dose, well, again, that was the Saturday figure, so really quite high numbers. That was the Sunday figure. 38.5% of the population now had 2 doses, but of course we have to wait, as indeed I am waiting myself, for the 2 weeks to elapse after my second dose. From tomorrow, 36-year-olds are going to be eligible in the UK. So the supply of vaccines actually seems to be fairly reasonable at the moment, I must say. I thought it would probably go down a bit more because of the Indians, of course, aren't exporting vaccines now. Understandably so. And so the supplies seem to be pretty good. Now, the India variant, yesterday we said there was about 1,300 cases, another 1,000 today. Officially genomically diagnosed, 2,323 officially diagnosed cases. Bolton, the India variant, is 81.4% of cases. Croydon in London, 74%. Nationally, it's up to 20%. So it's gone up from 2% to 20% in... It was 2% not long ago. It's gone up really, really quickly is the point. 20% nationally now. Now, having said that, the surge testing in areas where we know there's a lot of the India variant, like Bolton and Croydon, but it's still a pretty alarming trend. And there's no question now that this will become the dominant variant. 6 weeks ago, when I advocated stopping flights from India, I said I don't want to know what will happen if this comes to the UK because I'm hoping to stop it, so we never find out. Well, we are going to find out, and the answer is it's going to become the dominant variant. We believe the vaccines are still going to be effective, which is the key thing. But of course, there's a lot of younger people not yet vaccinated. Now, the surge vaccinations going on in Bolton. Now, officially, no one who is not eligible for the vaccine can be vaccinated at the moment. That's the official line. But there was some local politician in Bolton saying, turn up and people will find a reason to vaccinate you, which goes against the spirit of things. So really, we need this national policy to be enforced, or changed to being strategic. We shouldn't really have people making it up on the ground. Having said that, the people in the vaccination centres say they're abiding by the regulations. So, you see, every person who gets vaccinated who's not in the priority lists means that someone in the priority lists is delayed, because the supplies, even though they're better, are still limited. So, unfortunately, that is the situation. Greatly outcompeting the Kent old UK B117 variant, I'm afraid. Now, I've checked my phone this morning, NHS app. So go into the NHS app, just go to the App Store, download the NHS app. Now, this is not the NHS COVID app, which we all should have on our phones anyway. This is the NHS app, and you can check your vaccine records. Top option, your health tab, and it tells you your vaccine history. Not yet clear if this is going to be acceptable for overseas travel, but it's the best documentation we have at the moment. So I think it's just a matter of time till airlines start asking for some kind of evidence. Now, moving on to the States, let's have a quick look at some graphics from the States. Well, the cases are going down, no question about that. Cases are progressively going down in the States, which is good. Not entirely surprising as we come on to the summer months and vaccines increase. Deaths in the States are going down more gradually. Now, there's some other interesting things I'd like to show you here. This is the daily count of total doses administered and reported by the CDC of data administered of vaccines. So this is the vaccination page. I obviously include all the links. Now, the key thing is, although a lot of people have been vaccinated, the daily numbers are way down. So here we peaked at over 4 million vaccines a day. Impressive. Now we're down to 1.5-ish million vaccines per day. So we really just, if you're watching this video, then I think most of you think vaccination is a good idea. So encourage people to get vaccinated, because at the moment in the States, there's more vaccines than people coming to take it. And that graph is not really the sort of shape we want to see. And what we want to see is it going up and up and up till it just goes down all of a sudden when everyone's vaccinated. So daily vaccinations in the States, they're down. This was the variance in the States. Now, I did say that, actually, I'll just show you this graph. It's quite interesting. So this shows the increase of the B117 in the States as the proportion of those tested. Or does it? Yes, it does. So we can see that's gone up quite dramatically. And I was saying that the Indian variant of concern is not there, but it is there. It's I'll show you a blow up of this in a minute. B1 617.2, 0.3 to 0.7% of those genomically tested. But this just shows the way the B117 is increased in the States. But now that the India variant is in the States as well, I'm afraid I'm expecting that to become the dominant variant in the States as well. Let's hope it's not, but there's no reason why the few that are there shouldn't outcompete the B117. As we saw, the B117 outcompeted the previous variants. And this is still, I can't remember when this was done. I mean, that's actually says the 24th of April. So this is really quite out of date. It's surprising how out of date the American sites are, to be quite honest, the CDC sites. I really expected more up-to-date data than this. Anyway, so the United States cases last 24 hours, 28,692, 33 million officially diagnosed cases. Deaths, unfortunately, carrying on. Now 582,769 people have died with the virus. And these are the graphs I showed you. That's the case trends. Vaccinations, impressive numbers, 157 million. Fully vaccinated, 122 million. But in terms of population percentage, 47.3, 37%. So there really is a way to go in the States, quite a way to go. And as we saw from the daily vaccine tracker, which was that one, down to about 1.5 million doses per day, down quite a bit on what it was. Oh, this was that from the site there that I blew up just so you could see it. 0.3 to 0.7% B117. But as I said, really quite dated now. That date there is the 24th of April. So anyway, you're now as up to date as I am with the states, as all we know is from the official sites. So Thailand. There seems to have been massive outbreaks in prisons. Now, Thailand did really well. So we had a few cases way back, hardly any. Then basically it's been flat all the way through. And then at the end here, we're starting to get a few more cases. And this is slightly out of date. This is actually higher now, unfortunately, in Thailand. But there was 24 hours, the last 24 hours, by far a record number, 9,636 new cases in Thailand. Huge number. But most of those, 6,853 of those, are in prisons. Several prisons around Thailand, as far as we know. So massive outbreaks in prisons in Thailand, which is pretty bad news. But there again, it might be more containable. So, but certainly bad for the prisoners and the staff, of course, concerned. So quite a lot of those new cases in Thailand from prisons. So let's hope these can be contained. I'm not sure what the dominant variant is in Thailand now. I'm not sure about that. But that's a lot of new cases for prison. Now, we did look at Taiwan yesterday. Last 24 hours, 335 cases. 206 cases on Saturday. 12 deaths in total in Taiwan all the way through. Vaccines as of the 16th of May. And so I remember Taiwan. So this is Taiwan. Make sure we get it right. We were on Thailand. We're now on Taiwan. A bit of a difference. 23 million people is the population of Taiwan. And they do supply a rather good site. Bilingual. So obviously I've clicked on the English version. So we both understand it. But masks are required in places with high risk of infection and transmission. Passengers entering or transferring through Taiwan must present a COVID-19 nucleic acid test report issued within 3 working days. Another information there, infection control and reporting of suspected cases for testing are enhanced in healthcare facilities. Basically, Taiwan to temporarily bar non-residents without basically I think if you can't go to Taiwan at the moment is the story. That's the world. That's Taiwan there. So I've blown that up a bit so we can have a quick look at that. Now it seems that the Taiwanese, these are the cases reported, but presumably the doctors have excluded that many, and that leaves that many cases altogether for the whole pandemic. 2017 for the whole pandemic, 12 deaths. And here's the graphic. So now these blocks here, these bars are in weeks. So they put it slightly differently. So like that's the 5th week, that's the 10th week, that's the 14th week of 2020. So these blocks are in weeks, and this is up to date here, of course. So that's last week, and that's the week before. And after doing so well, bit of a blip there, but now a definite increase in cases in Taiwan. Unfortunately, very sophisticated country, Taiwan. Hopefully they can do something about it. But to be quite fair, they've taken the foot off the gas with the vaccination. This is from Jessica, who lives in Taiwan. In the local news just a few days ago, I read that only about 1% of the population has been vaccinated. This is partly because of supply. We have not had many vaccines coming into Taiwan as of yet. And the vaccines that have been distributed at the moment is the Oxford AstraZeneca, which of course is quite acceptable to me. And obviously the Taiwanese authorities. Although Taiwan is vaccinating people on a priority basis, many of those eligible have turned down the vaccine over the past few months where cases were very, very, very low. And those cases that were there were being quarantined. There wasn't any community spread at all for the vast majority of the time. Many of those eligible have turned down the vaccine, partly because they felt things are safe here and it's not necessary to be vaccinated. And also the bad press for the Oxford AstraZeneca vaccine hasn't helped. Separate topic, but we know that the risks are very low overall, and we're using the Oxford AstraZeneca in the UK. And I would have been more than happy to have it myself, for sure. Anyway, that resulted in supplies they did have not being able to be distributed before the expiration date. So for a couple of months, the government actually offered the vaccine to the public for a very reasonable fee. So they were selling it. And there's no implication of corruption there. That was just that was just anyone who wanted it could basically pay a small fee and get it. Now, however, with the new cases, demand is suddenly up, and the self-paid vaccines have been cancelled. The president said they're expecting more vaccines to arrive in June, another month yet, including 5 million Moderna and several million more Oxford AstraZeneca. So the population here is still very vulnerable. Unfortunately, in Taiwan. Now, I had a few other things I was going to say, but I think what we'll do now is we'll listen to Raphael, who gives us excellent reports from Brazil. So, Raphael, thank you very much for coming back on again, and over to you. Thank you.
Hello, Dr. Campbell, once again. Hello to all your viewers. For an update about Brazil again. So right now we are seeing a lower number of deaths for the first time in 55 days last week. We are with a moving average of 7 days below 2,000 deaths per day. So in a very high level, but lower than we reached 3,000 deaths per day in March, I believe, and April. So deaths are going down, but new cases are going a little bit up, 2-3% in a week. And it's kind of hard to understand a little better what's going on, because most of states in Brazil are going down. There's a trend of lower number of cases, and that's in the entire country. But there are a few states, and most notably the state of Rio de Janeiro, that it's the third largest population in Brazil by a state, and there the number of cases is the highest level ever. So maybe the state of Rio by itself it's putting the numbers of Brazil up a little bit, and maybe another indication would be the vaccination working. So we are seeing cases, but we are not seeing deaths. So that's an indication that at least the vaccination could be preventing deaths. And we are seeing that in the population above 60. Most of the population, at least in my city, for example, above 60, it's vaccinated. We reached in my city 32% of the entire population with the first dose, and 14%, just watched that, just confirmed, it's 14.2% of the entire population with 2 doses. So entire population above 18, of course. And so Rio may be the case for the cases going up. And I was just reading a little bit about 2 cities in the state of São Paulo that are going through a project called Project S. And it's the first city is Serrana. That it's around 32,000 people. It's 40,000 people, 32 above 18. That all those people had 2 doses of the CoronaVac, the Chinese vaccine, in February. And now we see that in May, we are in May 16. So there are no cases, pretty much no cases and no deaths there, because everybody already got the vaccine. The other city is called Botucatu and started a mass vaccination with the Oxford AstraZeneca vaccine. So in last Saturday, they vaccinated 65,000 people, and they selected this city specifically because it's a city in the middle of the state of São Paulo, and there's a lot of traveling around there, and they want to see the variants. So it's a place near some facilities more capable of doing sequencing. So they are looking for the connections about vaccines and variants. And so far here in Brazil, we have some level of sequencing, but not much. We know that there's several variants going around. Some are more important than others, but at the same time, we are just looking for more data on the vaccines, because we reached 57 million vaccines. Of course, most of its first dose, and around 20 million, I believe it are the second dose. And now we have the Pfizer vaccines as well. We already had the CoronaVac from China, the Oxford AstraZeneca, and now the Pfizer. And we are going to younger people. In my city, if you have some comorbidity, you can get a vaccine if you are above 35, I believe. And the idea is going, of course, forward with that for the next months. And in my personal experience, I of course I don't have I didn't got the vaccine yet. Because I'm not a healthcare professional and I don't have comorbidities, but at the same time I already had COVID, so I'm hopeful. I'm not. It's not guaranteed, of course, but I'm hopeful that I'm a little bit protected. And I can tell a little experience I had 2 weeks ago when I went to the south of Brazil by it's a bus travel. It's 14 hours bus travel, bus trip, and I went to work there because I work in broadcasting, and there was an event of go-kart racing, with around 60 drivers and around 400 people, just the minimum of the mechanics and people of the organization. When we had everybody tested, everybody using masks, everybody doing the distance they could, and I felt that it was safe. It was okay because, first of all, it's a pretty much an open space. Even in the garages, they took out the back part of the garage, so ventilation was 100% all the time. And from the 400, 500 people around there, we got 12 cases right in the entrance of the event, so nobody that got positive got in. And so we believe that it was a safe environment to perform an event, to work in an event. And so far as I'm aware, nobody got sick there. Nobody got sick in the city because of the event. So I believe that is a good indication of how we can go back to some level of normality in the future. Of course, no public in the venue. So far, I believe it's this, what I have to say. And I hope for the best in the near future for everybody. So stay safe. Good. Thank you.
Thanks for that, Raphael. Just such good reports, Raphael. His English is so much better than my Portuguese. So, but still a long tail of deaths there. It's taking a long time to come down in Brazil, isn't it? Glad to see the vaccination program's going well. Glad to hear that very positive news about the Chinese coronavac as well, that appears to be being effective, 100% so far from that particular town, sounding good, and the AstraZeneca and the Pfizer coming as well. I've done some 14-hour bus journeys. They're no fun. But and yet, no. On a serious note, we know you've had COVID, Raphael, and we would expect you to have a fairly good degree of protection while you await your vaccination. So, anyway, we really appreciate your taking the time to prepare those talks and give them a very interesting insight into the situation in Brazil. Can't beat intelligent, informed opinion on the ground. Of course, no, we'll leave it there for today. That's quite enough. I think it's evening time already. So, maybe tomorrow we'll look at this. That there's some data showing that delaying the second Pfizer dose has been a good idea, or it's looking like a very good idea. But we'll look at that tomorrow. Okay, that is us for today. Thank you, of course, for watching.